Ladies and gentlemen, thank you for joining us today. Loes Oomen, Loes van der Zanden and myself will introduce you to the European Reference Network developments and the European Reference Network EUROGEN for urogenital and rectal anomalies and complex conditions. This is the spring and summer edition of our update, and the next one is to be expected in 2023. So please join us today, and if there are any questions, this can be answered after this presentation. Now we would like to start with the first introduction. In the European health area and ecosystem, I think you can talk about competition or collaboration. And if the best for the future is thought to be that the sharing of information for the care and the cure of patients whenever possible might lead to the best outcome for all patients involved. Of course, there's always a conflict of interest, not only financially but also non-financially. But anyhow, to overcome this, I think we have to work together. In Nijmegen, we are one of the expertise centers for rare diseases in the urogenital congenital anomalies, and this implies that we have a long-term care for patients with a rare disease that is organized by a multidisciplinary care team with lifelong consultation options. And due to the development of the European program for rare diseases, we became part in 2017 of the European Reference Network EUROGEN. Now the whole ERN system is currently developed through the EU for Health program, which will run from 2021 till 2027. It has a long history, the ecosystem, because it started already in 2002, and then by legal implementation, the first call was entered in 2016. So we are reaching the end of the first years, and it's a long process which will develop further in the future. Like I said, the first call was there in 2016 and the launch of the 24 networks in 2017. And currently we are going into an evaluation phase. Now this is all, as I mentioned, supported by the European Program for Health. And this year already 52 million euros is invested into this whole system. Now it's a combination of collaboration between the European Commission, the member states, so mostly the ministries of health, as well as the hospital managers and the ERN coordinators. So in this kind of ecosystem, we try to develop this program as best as possible in different levels and different stages. There are 24 doctors involved, coordinating the 24 networks who are currently exist in Europe. And they are coordinated through different member states of the European Commission. These 24 networks also interact together on different levels, on different diseases, and in this way we hope that we can overcome the borders between the specialties which are there often in the clinic and might hinder the care for the patients as a whole. Currently, with the enlargement of the networks in 2022, there are 1,600 multidisciplinary teams, expertise teams, recognized by the Ministry of Health of each country. And this reaches over 300 to 350 hospitals. What we know from the last years, if we look at the monitoring data of 2022, almost all countries are connected, and we know now the number of patients for a certain disease area which is covered by the ERN involved. So now, up till now, about 1.7 million patients with a rare disease can be tracked and looked upon and evaluated and learned from to increase our knowledge of the rare diseases and the expertise which is there. For EUROGEN, we are currently involving 56 hospitals from 20 member states. So still a larger geographical coverage will be reached in the coming years, but at this stage, this will first be stabilized to see how we can interact in the best way possible. Like I said, this all started in 2017 with 29 hospitals from 11 member states, coordinated by Chris Chappell from Sheffield Teaching Hospitals in the UK and supported by the European Association of Urology. And each year we have at least one physical meeting, although with the Corona period, of course, this was changed to an online meeting. And we hope at least this year to have a new physical meeting to get a better interaction between all key players from the different hospitals. Now, what is in it? Like I said, in 2022, with more than 56 hospitals, with expertise teams recognized by the Ministries of Health from the 20 countries, we also connect affiliated partners, national hubs, patient representatives, which are called EPACs, and healthcare provider coordinators, currently is Radboud University Medical Center in Nijmegen. And this is all supported by financial funding to the EU for Health, the Connecting European Facilities, and special registry grants. Now, we started with almost nothing, just a few blocks which had to be done, and now you see today that at each block on harmonizing the diseases, there are guidelines currently being developed. There's collaboration with the supporting partners. In the monitoring, we look at the monitoring data, and I'll come back to that later. We collaborate with EURODIS, which is a patient organization, and the research we mainly develop currently a registry. But this is connected to other European developments. Now, in the online information, a website is operational, there are webinars and other mobility programs. So you see that at each field, actually, we are developing new tools for the improvement of the care. And a special tool is, of course, the clinical patient management system, where you have a video consultation, where we will come back to later. This is all through collaborations. And like I mentioned before, the European Association of Urology was the first to start this program for the urology field. And of course, we collaborate with ARNet, which is an organization for the anal rectal malformations, ESSEX, the ESPU, and the UPSA, as well as supporting individual partners and individual patient experts. On a global level, we work together with the WHO for rare diseases and see how we can improve the care on a global level, and building a network to work together and increase and improve the care for patients involved. With Australia, we have a memorandum of understanding for the anal rectal malformation registry of Australia and New Zealand, and we work with developing countries and Pakistan and regional countries also for anal rectal malformation patient care. So also at this level, we see now new developments exploring from the European networks. Now, what's in it for the teams? Well, each team is an expert team, has now new connections, knows at least the patient numbers, and which can be used for clinical, or can be involved in clinical studies to see how we can improve the care. There's a video consultation platform within a safe boundaries, within all legal requirements. We have a direct collaboration with patient representatives. New guidelines will come out, a registry participation will be possible. There are webinars, there's a mobility program, and there will be further developments in the research programs and publications. So a lot is there where you can use the new tools developed with the help of the European Commission. Now, in our network, we have a structure coordinating this. We have collaborations, as I mentioned before, and we work in 3 work streams, one for congenital anomalies, one for functional urological anomalies, and one for urological rare cancers and tumors. Now, this is the way we work, with interactions from left to the right, from the child to the adulthood. And new plans and expansion are foreseen in the future. Now it's a pleasure to hand over the further information sharing to Loes Oomen, who will talk to you on the clinical patient management system, and give you an update of the current developments.
Yeah, thank you very much. I'll briefly talk to you about CPMS, the Clinical Patient Management System. When a national healthcare provider sees a patient with a rare or complex disease, one might not immediately have an answer regarding the diagnosis or the treatment. And to improve care for these patients, one might seek advice from experts in the field. Within the ERNs, we try to make the information travel rather than the patient. So therefore, the CPMS Clinical Patient Management System was developed. And this is a digital tool that provides a cross-border consultation and is compatible for most common devices like a computer or a tablet. And it provides secure upload of patient data after a patient has provided written informed consent to share his or her data. And all healthcare professionals who are a CPMS member those identities are checked. So it's a secure environment. A healthcare professional can fulfill different roles within CPMS. There's a panel lead. This is the one who starts a panel. So if you have a patient you would like to discuss, you can start a panel and enroll this patient. The panel manager is quite often the same person as the panel lead. And this is the one who invites panel members, who schedules meetings, and who makes sure that the right information, the required information, is available. The panel members are the experts that are invited to join the panel. And they can give advice both written using the system or join in a panel discussion using the panel meeting functionality. When a panel case is discussed, an outcome is reported within the system, and of course the panel lead will discuss the advice with the patient. Well, this is an overview of the workflow, and when a clinician wants to enroll a patient, we as a CPMS help desk can assist with every step of this process. This is an overview of the CPMS activity within our network since 2017. In total, 163 registered users initiated 171 panels. However, you can see that the number of new panels and the number of active users remain stable. And we do see that we have a small group of very active, fervent users. When a panel discussion has taken place, the panel lead can close the panel, and he or she is asked to fill in a survey and to determine if the panel was successful or not. So in total, 86 panels were officially closed, of which the vast majority was considered successful. And in the early days, it took quite some time to close a panel, whereas this is true, has apparently improved over time. As I mentioned before, the numbers of new panels are staggering. And in order to identify the thresholds for using the system, we send out a survey, which revealed that many clinicians find the system quite difficult to work with. The initial startup requires several steps for safety's sake, which makes it quite time-consuming. And the enrollment of a patient is not that user-friendly. Besides, in the past, some technical issues caused some problems. And apart from that, some clinicians, the willingness to ask for help differs among cultures. And some clinicians might be more reluctant to share their insecurities. Well, in order to continuously improve the system, we are collecting input for improving it. And besides that, the Commission is developing a CPMS mobile app and is working on a whole new system which would be more user-friendly. The expectations are that the first release will be at the end of 2023. Besides to provide optimal advice and to learn from each other, we would like to intensify the collaboration with other ERNs. In the past, we did some joint panels with the Endo ERN, and for the future, we would like to do this more in order to learn from each other. I'll now hand over to Loes van der Zanden, who will tell you more about the research and the registry.
Thank you very much. Yeah, so the ERN EUROGEN research program is currently mostly focused on the ERN EUROGEN registry, so that's what I will talk about. I'm the registry coordinator. But of course I don't work on the registry alone, so here you can see the team of people who are working on the registry. So we have a developer, a manager, a project steering committee with also a quality coordinator, and we have an advisory board with representatives for each of the ERN EUROGEN work streams and also patient representatives. So the last 2 years we've been developing the ERN EUROGEN registry and all associated documents. The registry was built in Castor and currently it's ready to be used, although we are still developing more data elements to be collected. It is a centralized registry, so that means that all the data are stored in one location. But to make sure that the healthcare provider who entered the data stays the data controller, we also have a data sharing agreement that needs to be signed. And apart from that, we also have a data access and sharing policy, so that's a document that describes how we will handle the data. We have a protocol, a Castor manual, and we have patient information and informed consent forms that can be used. And we also did a data protection impact assessment of the ERN EUROGEN registry at the Radboudumc, and that can be used as a template for the other healthcare providers. Well, within the registry we are collecting, or we will collect different data items, so different groups of data items. We will collect the common data elements, so that were 18 data elements developed by the Joint Research Centre of the European Commission, and those data elements will be used in all ERN registries, so they will be the connecting point for all the registries. We developed clinical practice snapshots, so that are 6 specific clinical questions per expertise area, and that's about the clinical approach used for new patients. These clinical practice snapshots should be filled out approximately 6 months after a patient visited the healthcare provider, and this can be done by clinicians or by data managers using the medical files. And we are currently developing more data elements, so we are working on patient-reported outcome measure questionnaires. So these are questionnaires that patient or their parents, depending on the age of the patient, can fill out themselves. And it will not only have questions on outcomes, but also social demographics, quality of life, and satisfaction with the care process. And there will be multiple questionnaires at different ages or at different intervals after first visiting the healthcare provider. We are also working on follow-up electronic case report forms, so those will be similar to the clinical practice snapshot, but then with questions later in time about further clinical approach and care consumption. And again, these should be filled out by clinicians or by data managers using the medical files. So as I just mentioned here, you can see the data flow, let's say. So the patient enters the clinic, has to provide informed consent, the patient or the parents. And then the common data elements and clinical practice snapshot data elements can be filled out. And then afterwards there will be a follow-up period in which the parents or the patients will fill out the questionnaires, and data managers or clinicians can fill out the follow-up ECRFs. So we already developed the clinical practice snapshots for 5 of the disease areas of ERN EUROGEN. So these are the posterior urethral valves, anorectal malformations, pediatric kidney transplantations, the complex pelvic floor disorders, and adrenal tumors. And for those expertise areas, we will start with a retrospective pilot phase of the registry. So For these 5 expertise areas, healthcare providers that got approval to start with implementation of the registry, they can ask informed consent to patients that they treated previously for these expertise areas. And then they will enter data on the 30 patients that provided informed consent per disease area. So this will entail the common data elements and the clinical practice snapshot. And this will help the clinicians to get familiar with the registry, to test the registry and provide us with feedback that we can process and improve the registry with. And it will allow us to do a snapshot of the current clinical practices used in Europe. After this retrospective pilot phase, we will start with the prospective phase of the registry, and then clinicians will ask informed consent to all new patients, and we will collect these common data elements, clinical practice snapshot, and also all this follow-up information. So that will be to identify cohorts of patients for clinical research and to monitor treatment performance and patient outcomes. But of course it will also allow research. So if researchers want to use the data for their analysis, then they can apply for the data with the project steering committee. And the data will only be provided if the responsible clinicians approve. So the healthcare provider can decide themselves whether they want to participate in a certain project or not. Data will only be provided with a data transfer agreement, and it will be provided as anonymous as possible. And then the researcher can analyze the data. And then in publications, then each healthcare provider can name one co-author on these publications. And they all receive the final report so that they can use the results to improve their care in their institution. So back to you, Wout. Yes.
Thank you very much, Loes. Thank you. Yes, how is this all connected? If we talk about 24 networks, well, the idea is that in 2025, at least 500,000 patients will have provided their informed consent from all networks together, and this can be interacting with other European research institutes and new programs. So you see, it's a whole new development. It's also interacting with the European health data space, which is one of the strategic areas for data in Europe, and it's called Common European Data Spaces. And one of these data spaces is related to the health data and development, and this can be connected through national, local centers, and the ERNs are one of the groups of data collections which are thought to be part of this, and which is also related, I think, to the development of the European Health Cloud. So this all interacts together to learn and collect more information on rare and ultra-rare diseases and how the care can be and the cure can be improved. From a research point of view, as was mentioned, there's also support from the European Commission on a European Joint Programme for Rare Diseases, and our members use this support to organize a cross-ERN work group for spina bifida together with the ERN Ithaca. And this took place this year in Rennes. So from different sources we can use support to find new ways to collaborate and to reach new knowledge. A platform has been developed where the website is mentioned on this slide, where you can find the different developments which have come out of the current program on rare disease research in Europe. For the future, currently there has been work done for the new European Partnership for Rare Diseases under the Horizon Europe program, where again the European Commission is reserving money which will be matched by the different member states, and then new research programs can be developed and are currently being developed in a strategic agenda for the next 7 years, which probably will start in 2024. So again, the ecosystem for rare diseases is combining forces in Europe to get a better outcome and better future perspective. What was mentioned, the 18 monitoring data parameters are currently collected in order to find new ways and new information on how many patients are seen actually and what is done. Well, the what is done will be collected through the registry. Although, if we look just at the figures which were published in European Urology this year, we know that over the last couple of years, more than 120,000 patients were seen by the members at that time of the network. And this involves only 29 hospitals. So we see now that we know for each rare disease how many patients are seen from 2013 onwards. And if we double this information by the increase of number of hospitals, then we will be able to find the ground line for the number of patients who participate in the registry, as well as those who are willing to participate in clinical studies. Therefore, this information collection, which seems to be very simple, we know it's not always validated in all hospitals, and it's not always easy to collect, but on the other hand, it's the basis where we work from. Now, what else did we develop? Well, currently we are running about 40 webinars a year, something again which is new for the rare diseases. Each Wednesday, or mostly each Wednesday, there will be a webinar between 6 and 7 o'clock in the evening, just before your dinner at Central European Time, and there you can learn on different fields, different views on the care for patients. This is not only done by medical experts, but also by nurse specialists, psychologists, or whoever thinks that they have knowledge to share with the others involved. Now, what's in it for the patients? Well, if you look directly at the patients, I think it has never been more that patients or patient representatives have been actively involved on all levels of these European reference network developments. They are connecting now to the expertise teams, and they know the patient numbers in the different countries, the organizations involved, when they are in place. They can use actually or ask for a video consult through the CPMS system, which was discussed before, and the panel outcome has to be shared once the patients have given informed consent. Anything can be done only with informed consent of the patient. Again, also for the registry, it's only done, data can only be entered once the patients have given their informed consent, and it's always their option to cancel their informed consent. Of course, the data used cannot be disappearing, but at least if patients don't want to collaborate anymore or don't have the time to collaborate, then it can be ended. So nothing is fixed for the ever. But again, the registry with long-term follow-up foreseen over 25 years will provide new knowledge which have never been there before. And besides this, the patients are directly involved in the development of the guidelines for which the basic support of information comes through the registry. So it all interacts with each other. Also, patients themselves have been actively involved actually, as they provided the overview of urological and surgical journey information. So what's happening with the patients over their lifetime? This is one issue. And the other is, of course, which are the common needs for rare, complex urogenital and anorectal malformations. How can we use this? If we know these factors, then we can work together with other researchers and look at the common challenges of uncommon conditions. So psychologists are currently working in the yellow area on which is common challenges for each parent or patient with an uncommon condition. And there was a webinar on this which you can look at back. The other thing is where we work closely together with urologists was within the RARE 2030 foresight study. So there was a 2-year foresight study to develop what are the recommendations from the rare patients to the medical field and what do they expect in the future. And experts from all the ERNs were involved in the discussions. So direct interaction between the patients, patient representatives and the experts in the field. This is only one example. Another example is the collaboration on new guidelines. So money is provided by the European Commission again to support the development of specific guidelines or clinical decision support tools for these rare diseases. And again, we work together on a protocol for these guidelines. So how should they be developed? What information level is needed? How is the evidence? Or can it only be a clinical decision support tool and not a real guideline? Again, we work together with all our supporting partners to see and develop this further. And currently we're working on 3 different guidelines and 1 clinical decision support tool. Another option offered this year and last year is the exchange program. So besides the exchange through the research field, we now have also a clinical exchange program in place where people for 1 week or up to 4 weeks or 6 weeks can travel to another center and to see what they are doing, how they are treating patients and how they have organized their care. Again, a mobility program which is a pilot and will be evaluated by the end of this year to see if we can continue this and in which form. It was hindered a little bit by the COVID, but now it's open again and people can participate. One example is a visitor who came to us and he describes his experience, and it's always good, I think, in my view, to visit another clinic and see what's happening and what you can use in your own clinical setting. Like I mentioned before, it's an ending story, it's a never-ending story, it's a program, it will run through, but it will be evaluated and it will be looked upon to see what is the added value in the European setting for this. So this year we will start the evaluation of the first 5 years of the program and see what can be improved in the future and how we can help to develop this further. What is it in the future to be expected? I think, like I mentioned before, we're connecting 1,600 teams of many different countries, of all countries of the European Commission, to work in a better way together and share the information to see how we can improve in all levels the care and cure for these patients. Now, this is something unique. It's an ERN ecosystem, as it's called, and different tools have been provided by the European Commission, like the patient management system for video consulting, the knowledge generation, the research on rare diseases, which is coordinated better, and the education and training of new doctors of the future, and not only doctors, but all people involved in the care for these patients. Like I said, there are many different ways to look upon this. We will manage the enlargement of the networks, of all 24 networks, the 1,600 recognized expertise teams, and then see how we can improve and where we can improve these collaborations as well as the developments. And we have to demonstrate, of course, the added value of the whole system. But up till now, nobody is disputing this, as we have seen a lot of new knowledge which was not there before. And also, there is a future, of course, how this will develop further. So there is a vision already up till 2020-30 or 2020-40 even, to see where this should be heading and where collaborations and cross borders are there and how we can handle this. Now, like I mentioned briefly before, there's also a global development by the WHO, where innovation by patients' needs is the key point, and how on a global level we can work together and share the knowledge, but also use the local knowledge to see how we can learn from each other. How can you keep track on this? Well, there's a website, of course, of ERN EUROGEN. We have regular newsletters which you can look upon the website or ask to be written to receive these newsletters. There are the webinars. Next year the ERN Academy will start with all educational materials, and we're currently developing a book on rare and complex urology. Now, for this time I would like to thank you all for your attention. Hope that we provided with some new insights, and please don't hesitate to contact us if you need further clarifications or information. Thank you very much.